the role of our healthcare center is to think more about how to improve management training and skills as well as innovation, and that there has to be kind of a balance between the two. Essentially, normally when you look at a portfolio of investments, you think about what's the risk, which is the cost angle here in healthcare, and what's the return, which is the outcome on the vertical axis. And typically you're saying for a certain risk profile, higher risk would require a higher return to be efficient. Low risk requires low returns to be efficient. So when we look at it and take that kind of model and apply it to healthcare, we think about higher cost healthcare, you would think would get better outcomes. Lower cost healthcare should get less outcomes. And our hypothesis is the stars, which are either institutions or healthcare systems, are actually underperforming. And when we use innovation, all we're doing is pushing the frontier out and saying aspirationally we can do more with innovation. But in reality, we also have to think about how do we manage what we have right now. And I think we're trying, at Ivey, we're trying to change that focus to say, yes, we want to think about innovation. We want to continue, we want to push out that frontier and provide better care. But we also have to manage the care better. And we don't think we're anywhere near the efficient frontier, which that previous graph would have showed you we're 42% waste in the system. So as far as what our center is doing, we're also looking at how we can effectively balance working with management and also working with innovation as to purely working in the innovation space. So our center was founded in 2009. We've kind of, we serve as a gateway for research, education, and outreach, and we're trying to be kind of an objective third party that tries to emphasize value-based healthcare, which is a movement that's been gaining traction in Canada and the United States and around the world, predominantly spearheaded by Michael Porter out of Harvard, along with Bob Kaplan, an accounting professor there, and a couple other ex-Harvard people, Elizabeth Teesberg and Scott Wallace, who now are at the Dell School of Medicine in Texas. But this is something if some of you have heard of. I know Medtronic is certainly a fan of it. I was at 3M yesterday. They were talking about it. Everyone here familiar with value-based healthcare? Okay, so we're really, go ahead, sit down. I'll stop for a second.
Thank you.
Yeah. -1 contribution today. Did you go to Ivey?
No, I went to
Okay. All right. Well, if you go to Ivey and you're late, you get negative contribution. At least in my classroom. Okay. So what we're trying to focus on as a center is all based on value-based healthcare at the center and our foundation for our thinking and how we engage with the community, basically either in the public space or in the private space. And we look at kind of 3 areas we look at. We spend a lot of time in management education and leadership development trying to get kind of the business skills and management skills into the healthcare system and try and improve upon that so we can get out to that frontier by being better managers. We look at adoption and advisory services. That's where we're still in the innovation space, but we're not in the incubation piece. We're at basically where you've got a product that's already been demonstrated or had a pilot, but how do you take it to the next level of commercialization? How do you get it from I've got a pilot, I've demonstrated in one site that's successful, how do I scale it or diffuse it or get into the procurement system? And also we work along health systems design and operations management, which is more about driving efficiencies through the entire system. So when we talk about supply chain management and operations management within the healthcare space, we're really talking about how do we take the firms and the system as a whole from being this kind of firm that's, this system that's inefficient to one that's driving competitive advantage through operational excellence. And that's part of what we're trying to do at Ivey now, and that's part of how we're trying to focus on increasing management skills and driving or helping firms with their efficiency efforts in designing and operating their systems.
So supply chain management really became a business practice in the 60s and 70s, and it started in the grocery and retail chains. And it really originated as a means to find a competitive advantage. So you had industries with extremely low margins and extremely high volumes where anything they could do to reduce costs or reduce waste had a direct impact on the bottom line. So companies started to pay more attention to their supply chain, started to put in practices to try and optimize it, but it hasn't translated directly to healthcare quite as quickly as some other industries, and there's a few reasons for that. And if you imagine what an optimized healthcare supply chain would look like, you can imagine hospitals having things like bedside scanning where you can scan a patient's wristband and then scan a a drug to make sure that patients are getting the right drug at the right time in the right place. You can imagine efficient recall administration, where if a medical device manufacturer has to recall a certain product, they can go into their computer system and right away tell which hospitals the products went to and which patients the products went to. You can imagine medication authentication. So like I said earlier, where you're guaranteeing that the right patient is getting the right medication in the right dose.
Is the supply chain about shipping a box, which it is, or is it also about saving a life, which it also is?
Over the years, like I was saying earlier, a lot of the emphasis has been put on how do we reduce that upfront price? Let's put reverse auctions in place. Let's just reduce the upfront. But there's been a growing sentiment across Canada and around the world. I just came from a meeting in Amsterdam where value-based healthcare was all the rage at a compliance conference. The conversation kept going to how do we implement this away from compliance? The moderator had to keep taking it back. There's so much interest in how do we get there. And I think what we have to do is look at the processes that are required in terms of doing it to go from a product to a solution. Now, one of the examples, there's a number of places in Canada where this is ongoing, is Alberta. So as we continue to nickel and dime and look at the upfront cost, if we could move to the systems approach and look at the solution on a broader perspective, there's a lot of savings to be had. And I think for procurement, as Neil was mentioning, it's going to play a key role, but it's going to be a paradigm shift. And that's the conversation that went on in Europe, and that's what Alberta's trying to deal with right now. How do we shift that paradigm?
What's right with the current system globally? There are solutions that are out there that don't need to be expensive, technological solutions to make the supply chain more efficient. The province, we started to see some consolidation in the marketplace. Even before the supply chain panels come out with their recommendations, we've seen movement with Plexus and other SSOs in terms of knowing that the government is likely going to look at a more consolidated landscape in how supply chain is delivered across the province so that the province can actually fully leverage its buying power and seize the opportunity, even with very tight timelines, with, let's say, 6 months leading into an election. As I said, there's plenty of reticence, both on the outside and on the inside of Queen's Park to change, but it's ultimately up to the leadership to take that by the reins and to drive some progressive change. Like I said, there is some low-hanging fruit that's sitting before the minister and before the premier, and I think that keeping the pressure on our elected officials to actually drive forward with some of this change would be wise.
A lot of people involved in the provision of healthcare and bureaucrats and politicians are all nodding their heads about value-based healthcare. I shouldn't say all. Most people are nodding their heads that it makes sense. But if you look at a hospital CEO, I think hospital CEOs, most of their performance review or their job performance is about saving costs up front. And some of these solutions are going to involve a little bit of time before the return on investment of the better outcomes is there. So how do we deal with it where you make it a mandate at the end of the day, where it becomes a mandate so that there's a desire to change and understand the scope of that change as we go forward too in terms of what can be done. It just can't turn the world around. You can't turn a large battleship with an oar. But how do you start that particular process of that particular change? How do you make it a mandate? Like I see the province of Ontario where they give $20 million towards something, great. But look at the entire healthcare spend in Ontario. I don't have the number off the top of my head.
Yeah, 52 billion?
Yeah. It's a mandate, and how do we make it work? So there's intentions are good, but what worries me, what keeps me up at night is what turns this into a mandate, and how do we keep it going? Because there's a lot of good people that want to do it.
And just to add to that stat, 16 to 18% of the healthcare budget in Ontario is consumed by supply chain costs. So that's how important the decisions are in terms of making it more efficient. So you put that in perspective, it's approximately $8 to $10 billion annually of the Ontario's healthcare budget that goes directly to supply chain costs. So.
Just one point I would make about value-based healthcare is it's sort of loosely defined as being, the outcomes divided by the costs. And guess what? We don't measure either. So I think one of the biggest challenges and opportunities, and that's why I'm a big fan of bundled care, is to actually get really granular. If you talk to anybody, I'm sure from a business school, they would say, that it's ludicrous that you can't measure these things, because they can measure them.